Today we'll be doing a strengthening workout to work out large muscle groups under your armpit to take the pressure off your neck. This is not a full workout. This is just my suggestions for a few exercises for selected muscle group. Therefore, it would be the best to see an exercise professional, for example, Pilates instructor or PT or EP, to take you through a full body workout, particularly if you suffered from any injuries or if you have any specific needs. For today's workout, you will need a thera-band, appropriate strength for your needs, and I would advise you to purchase a door anchor. It's a strap with a loop like that offers attachment points for your thera-band that you can anchor against the door and door frame. It is probably the easiest and the safest way to find an attachment point in your house, particularly for lat pull down exercise. They come separately like this. They also come together with a rubber tube like this. And these rubber tubes are stronger than thera-bands, so therefore they're quite good when thera-band is no longer strong enough to challenge your muscles. They come in different colors, so they come in different strengths. And another good thing about them is that they come with handles. However, these handles could be purchased separately as well and attached to your thera-band. So if you wished, you could purchase them for your thera-band. However, we will manage without the handles, and I will show you variations for exercises using thera-band with and without the door anchor. So that's it for housekeeping. Now let's get down to work. To warm up your spine, use cat and cow stretch and opening like a book exercise from the first video on neck pain. I'll show you warm up for the shoulders, and that one can be done in standing position as well as in lying down position, and I like to do it in lying down position. And I like to use a roller for additional challenge for my core muscles. So if you have one, grab it, place it vertically on the yoga mat, sit on the edge of it, spread your legs wide for stability, use your abs and your arms to lay yourself down on the roller. So your spine is exactly along the roller. Now, as you're lying on the roller, your knees could be widespread apart or a little bit narrower if you want to challenge your core a little bit more on this unstable surface. So depends how comfortable you are on it. Judge yourself accordingly. Now, alternating straight arms, move them along the motion in the shoulder joint. All right, so alternating, you're going to be stretching out your arms and taking them overhead. Alternating motion. Go as far as you can, nice and slow with control. The more you do it, you may increase your range of motion gradually. There. And so, Then stop in the middle where your palms face each other and let the hands and arms spread wide apart. Touch the floor with the back of your hand and come back to neutral. So in this case, you are working along different angle and different motion in the shoulder. You can pretend that you're doing the chest press. And so you're bending in the elbows, bringing them to the floor and pushing away from you. Right? So pretending that you're doing a bench press. And you could, if you wanted, grab some light weights and do it with weights as well. It's a great position for chest press. Then place one hand on the floor for stability. As you circle the other shoulder along the range of motion. So the circle, try to make it as wide as you can. So you're stretching the muscle as well as mobilizing the joint capsule, warming it up and lubricating. Then reverse the circle. Go along that motion and swap sides. Place this hand now on the floor and the other one will be doing circles. So as wide circles as you can, go along your range of motion. Now grab a thera-band and you can do similar exercises with thera-band. Apply a little stretch on thera-band and go along the shoulder motion overhead and come back to neutral. Go as far as you can. Now both shoulders are moving together. You can spot that maybe one side is a little bit more loose than the other. Okay, see how far you can go. Then stop in the middle with your arms stretched out in front of you and apply a little bit of tension and stretch the thera-band and come back to neutral and stretch thera-band. And so again, that motion is coming from the shoulder. So you should feel it in the shoulder joint. Okay, to get up from the roller, use your arms and your abs to lift yourself and go back to seated position. Alternatively, if that's not easy to do for you, you can very gently let yourself drop to the side from the roller. And then go on your side, lift yourself on the elbow and go to seated. My first strengthening exercise will be Pilates hundreds. This exercise is taken from my Pilates classes and it's excellent exercise to strengthen your core as well as to engage your big muscles from under the armpit. So use yoga mat or a rolled towel under your head. Place yourself on the mat face up with knees bent, knees and ankles hip width apart. And take a deep breath in, and on breath out, you will draw yourself forward, so lifting your upper back and drawing your hands as far forward as you can, as you are reaching something that is right in front of your legs. Breathe in and come back to rest position. Once again, breathe out and draw yourself up and forward as far as you can. And this motion is done from your abs. So if you feel it in the neck, that means that you're using your neck, not your abs muscles. Or you're not drawing your shoulders forward enough. So you will have to use abs and the muscles from under the armpit to lift you up and draw yourself forward. So once again, breathe in and out. And draw yourself as far as you can. Come back to neutral and breath out. Engage your core. And breathe in, come back to neutral. Now, try to do 10 to 12 repetitions. You can do bigger or smaller breaks in between the contractions. If that's easy to do, put your legs in tabletop position. So hips 90 degrees bent and knees 90 degrees bent. And so take a deep breath in and out. And you're lifting yourself and drawing forward as far as you can. Come back to neutral as you breathe in and breath out. Breathe in. Try to always keep your low back imprinted to the mat, so that will help you to engage your core. If this is too hard, go back to bent knees position. Okay? If tabletop position becomes easy, what you can do, you can stretch out your legs in front of you, heels together and toes spread apart, and do the same. So breathe in and out and draw yourself as far as you can and come back. This one will be the biggest challenge for your core. Therefore, if you feel you're losing contact between your low back and the mat, that means this is too challenging for you. And then come back to tabletop position. Okay. So try to aim 10 to 12 repetitions for whichever position is comfortable for you to start with, and then progress from then. Take a breath in and out. Draw yourself up and forward as far as you can. And you're aiming to stay there as you wave your arms or beating your arms in this sort of wave motion. And so breath in for 5 beats and breath out for 5 beats. And you stay really squeezing your core and really drawing yourself forward. You're aiming eventually for 100 beats. However, if you get tired, you can have little breaks in between. Or I suggest you to build up from maybe 10 beats at a time. Have a break. Again, 10 beats, have a break. And then if you can, go another 10 beats, have a break, and eventually you will build it up to 100 beats without using your neck muscles, right? So only really relying on your abs and the big muscles from under the armpits. So that will be your goal of the exercise. My next lot of exercises are seated rower with the different variations of the arm position. These exercises could be done also in standing. And so I'll show you later standing rower using the door anchor. So find a heavy object in your house, such as heavy dining table leg. Loop your thera-bands around the leg of the table on the level of your shoulders or slightly higher. Okay, sit in front of the dining table with legs bent comfortably and slightly leaning backwards. So you don't want to be rounded. You want to stay straight from between your shoulder blades to the pelvis, and you want to have your core engaged. Okay, apply tension to the thera-band. Wrap the thera-band once or twice around your hands so you have appropriate resistance. So the resistance should be as such that you comfortably can do 10 to 12 repetitions. If you are not able to do 10 to 12 repetitions fairly comfortably, that means that the thera-band is too strong for you, or maybe you have a little bit too strong grip. Or if it's way too light and you can go comfortably much more than 12, 20, that means that the thera-band is probably too light for you, so you need to increase that strength. So, first variation is with palms facing each other, all right? Your knees could be bent in front of you, or also if you're comfortable, you can stretch out your legs, or you can let the knees drop to the side, or you can sit cross-legged. It's up to you what's the most comfortable. So your shoulders are drawn down as you pull the band towards you. Your elbows are pointing slightly to the sides. So on breath out, you pull to yourself, breath in, let go. Your trunk is totally stable. And that's a little bit easy for me, so I will increase the strength. The next variation is let the thera-band go in between your fingers, this way. Point your palms down to the floor and your elbows are wider spread apart. However, no higher than your shoulders. So this is the proper rower position. And so on a breath out, you pull the elbows towards yourself, slightly pointing down. So making sure that you're using still your muscles from under your armpits, not the neck muscles. So your shoulders should stay drawing downwards. And this is again too light for me. So no movement in your trunk. Trunk stays very stable. And you're using your breath. The last position is with your palms pointing to the ceiling. Right? So still the thera-band is passing through your fingers. And in this case, your elbows will be really close to your trunk, pointing backwards. So as you take a breath in and breath out, you draw the elbows directly backwards. Still drawing your shoulders down, engaging your core, and using your breath. For each variation of the rower, do 10 to 12 repetitions, ideally 3 sets. If you go to a point that it's really easy, you can either increase the repetitions in the set. So instead of 12, you can do 15 or maybe 20. You can increase the sets. Instead of 3 sets, you can do 4 or 5 sets, or you can go for stronger thera-band or maybe eventually the rubber tubes. Now, I will use the door anchor. I'll pass the thera-band through the loop and I will attach it to in between the door and the door frame, a little bit higher than my shoulder level. I'll close the door and just check for security. And the same principles apply. So I will wrap the band once or twice around my hands. I will stand in wide stance, slightly knees bent, and gently leaning backwards, right? Still engaging my core, tucking my pelvis under slightly to encourage the core activation. And my first exercise will be with palms facing each other, and I'll be taking the elbows backwards towards myself as I breathe out and breathe in as I let go. So my trunk is stable. Later, I'll change the position of my palms and I will let the thera-band go through my fingers, my palms facing the floor, and I'll be taking my elbows backwards and also drawing slightly down. So making sure that I use the big muscles from under my armpit, not my neck muscles. You shouldn't feel it in the neck. And lastly, I will draw my palms up to the ceiling and I will take the elbows backwards very close to my trunk. This way, I make sure to engage different fibers of the muscle that I want to target. For lat pull down exercise, I will place the door anchor over the door in the middle. I'll close the door and I'll pull the anchor slightly just to check if it's secure. I have my yoga mat on the floor and I will kneel down on my yoga mat. If it's hard for you to kneel down, you may bring a chair and sit in front of the door and do it seated. If you can though, you can sit on your heels as well for extra resistance. So that's how I like to do it. And I will gently roll my pelvis a little bit backwards so my back stays in line. So it's not too extended this way because that actually hurts my back. So in order to protect my back, I will roll my pelvis slightly backwards as I engage my core better this way as well. So in this case, you can also have the band in the middle of your fingers. And as you breathe out, pull the thera-band downwards as you have your elbows wide spread. And breath in and out. So again, trunk is stable. My neck is relaxed. I may tuck my chin slightly towards my chest. And I'm using my core. That's where I should feel this exercise. So you might be stronger for this exercise. Therefore, you may increase the number of repetitions for it. If you use the same band, so instead of 10 to 12, do 20. So 3 sets of 20. If that's not enough, do 4 or 5 sets of 20 and see if this way you can actually feel the muscle and to tire it a little bit, because that's our aim, to tire the muscle, to engage it better. Or you can go to a stronger thera-band or eventually maybe rubber tubes. If you use these exercises 2 times, maybe 3 times a week, and you're consciously drawing your shoulders down and minding your posture and doing your breathing exercises, you should feel significant improvement in your neck muscles and also in your posture over time. Now, hold the ends of the thera-band, step into the thera-band and apply tension on thera-band. So you feel your shoulders drawn down by the strength of thera-band and go through your neck motion. So once again, left ear to left shoulder and use your breath. Right ear to the right shoulder. Chin to the chest. Look up. Look over the shoulder. Look over the other shoulder. Additionally, you may take your left ear to the left shoulder as you rotate and look up to the sky. And look down. Look up. Look down. If that's comfortable. Otherwise, stick to looking over your shoulder and looking the other shoulder. Then tilt to the other side and look up, rotate to the side and rotate to the other side. rotate up, look up, and rotate back, look down. To stretch the back muscles that we just worked, I'll give you a few variations as well. So first, you can find a chair or some reasonably low flat surface in your house. Kneel down in front of it, place your forearms on the chair, palms facing up. Your knees hip width apart and more or less underneath your hips. And what you will do, you will drop your chest, breathe through it as you stretch your shoulders and keep your spine in line. So neck in line with the spine, look directly downwards. Relax your upper back. Use your diaphragmatic breathing here. And see how your shoulders are. You may actually feel some pull in the shoulder, so stay as long as you comfortably can in this stretch. Now, as you can do it on the floor, simply go to child pose with your shoulders, with your arms stretched out in front of you with palms up. And relax into it. Relax your neck. Place your head on the floor if you can. Try to keep your elbows straight and palms facing up as you breathe through it. Use your diaphragmatic breathing. Relax your back. If you're not able to sit on your heels because maybe of too tight hamstrings, it's okay not to go that far. You can simply relax into it in this position as well. So stretch your forearms in front of you and relax into it. Try to keep your spine in line. (20 to 30 seconds). See which stretch works the best for you and use that one. I'll be very interested to hear from you and to know how did you go with it. Did you feel well after or not? What worked, what didn't work? So please let me know how you go with it and if you have any challenges with it. For my next lot of videos, I'll be looking into low back pain. So watch this space.